Well, there are several unmet needs for management of patients at risk of exacerbation who have COPD. One of the major risks is that we need more medication. We need more interventions to prevent these exacerbations. We do have some that work, some that don't. That's another unmet need, is to identify who is the best responder to what medication. And that really would lead to a more personalized approach to the treatment of these patients. So prevention, I would say, the treatment of exacerbation is usually has been well studied, and we have good treatments when it happens. But the more important is to prevent and know who would respond to what medication. So we studied budesonide formoterol delivered in a new technology, which is the co-suspension technology, using a meter dose inhaler twice a day. Obviously, there are other long-acting beta agonist inhaled steroid in the US market and in other markets that are available for COPD. Some are meter dose inhalers, some are dry powder devices, other are in soft mist inhalers. This technology, we believe, because of the co-suspension technology, may help deliver the medication better to the lung, although there are no comparative studies. It's yet another new technology to deliver drugs, to hopefully deliver drugs to the target, which are the airways. Yeah, so we presented here at ATS the data from the SOPHOS studies, which was a large multinational randomized controlled trial to look at patients with COPD who are at risk of exacerbation. This study was a 12 to 52 week study, so it was a variable duration study, enrolling patients at risk of exacerbation who have COPD. And we randomized these patients to either receiving 1 or 2 doses of budesonide formoterol in a co-suspension technology MDI, or formoterol alone, which is a long-acting beta agonist alone. And in this study, our main outcome was looking at lung function at 12 weeks, but also we looked at secondary endpoints, looked at duration, exacerbation, mean exacerbation, but also time to first exacerbation, as well as we looked at quality of life and patient symptoms. Yeah, the main findings of the SOPHOS study where we first met the primary endpoint. We found that both doses of budesonide formoterol combination improved lung function significantly more than long-acting beta agonist alone, which is formoterol. But also the secondary endpoint were significantly affected. Patients on these medications had lower exacerbation rate, and the time to first exacerbation was longer if a patient was on inhaled steroid and long-acting beta agonist. What was interesting is that we didn't find major differences between the two doses in these endpoints. But when you look at cutoffs of patients based on their baseline eosinophil count, which was taken in consideration when we randomized these patients, baseline eosinophil count more than 100 seems to predict better response to these medication, both in lung function and exacerbation reduction. And the higher the blood eosinophil count at baseline, the better effect or response, stating that possibly using eosinophil may be one of the biomarkers that can help us identify the responders in that high-risk patient population.
Okay, thank you.
Well, you know, there's been lots of controversy about the role of inhaled corticosteroid in COPD. Our studies suggest that adding an inhaled steroid in this high-risk population to a long-acting bronchodilator does have benefit, not only improving lung function, but reducing exacerbation. In addition, our study emphasizes the potential role of using blood eosinophil as a biomarker to predict response to these medications. For example, patients who had lower than 100 absolute eosinophil count, do not have a bigger response with an inhaled steroid on board. Thirdly, we looked at safety over the one-year study, and we looked at the signal particularly of pneumonia, which has been implicated with other inhaled corticosteroid. And in this study, pleasantly, we showed that there was no increased risk of pneumonia in the one-year study in this high-risk population.